One of the other biggest and most exciting things for Trek is our on-site clinic. Opened in 2011, and I liken the beginning of our on-site clinic kind of to the similar starts of our fitness center in a small room, limited services, not awesome. But what it is great is that it gives employees a free service for anything from blood draws to prescriptions, you name it. You can go in there, it's all free of charge. Why do we do this? So again, we talk about saving money. Wellness is a tough thing to grasp. How much money are we saving when we're doing wellness programs, right? This one's a pretty simple thing to grasp. Trek picks up, let's say, 75% of the employee's bill when they go to the doctor, right? We know that a PCP visit is about $200 per person. We can pay a fraction of that to have somebody at our place full time. So that's why it makes sense, first of all. Secondly, it builds our culture as we talked about. You walk in the doors, this is awesome. What a great service to have for your employees. But like I said, we started in 2011, partnered with UW Health, very limited space and services. So currently only our employees can use this. Again, it's free of charge, which is nice, but that's pretty small. We only get 4 or 5 people going in there every day. What's the most exciting part of my job right now is that on Monday, literally Monday, I got final approval to increase our space by 10-fold. So we're putting in over 1,000 square foot on-site clinic, and we're in the process of changing our model of healthcare within Trek. So this is really exciting stuff for us. What we did was we hired 2 different physicians that both had specific training in what we want the clinic to be. Instead of a sick clinic, you go in, you're sick, they give you a pill, you walk out the door. It can be a lot more than that. I sat down with Dr. Gallagher, the director of our clinic, and I asked her, I said, well, here's my, when I was in 2007, I went to the doctor, and this was my situation. I walked in the doors, you know how it is, you wait for 15 minutes, they call you back, the nurse sees you for about, what, 2 more minutes, you wait for another 15. The doctor finally comes in, 5 minutes later, she says, and I love my doctor, nothing against her, Marcus, you need to lose some weight, you need to exercise. You need to exercise, you need to eat healthier. And then I was on my way, right? Okay, so, well, what does that mean? There's no answers for that. And so I talked to Dr. Gallagher, I said, what is your training and what is your background as a physician in those types of things? She said, you know what my only nutrition class was in medical school? I said, I know, I was curious, She said, the dangers of supplements. That was the only class she ever had on nutrition. So nothing against our physicians, but they're not trained in the field of delivering these other services. So we actually have 2 people who went through a fellowship program down in Arizona. If you haven't seen the movie Escape, I'd recommend it. They talk about this fellowship. But basically, it's an integrative medicine program. So they both went through this thing. It's 1,000 hours worth of nutrition education, holistic medicine, you name it. But we're changing our clinic from a sick model to a preventive model. So you walk into our clinic with a cold, that's great, but let's talk about why you're getting that cold. Are you getting enough sleep? Instead of a 15-minute conversation, it now is an hour-long conversation about your health history, getting you actually on a plan to get healthier every single time you walk into those doors. Also going there because you're not sick, that's really the key.